Today we're discussing fish facts, risk communication techniques to reduce health risks and improve health outcomes with Dr. Laura Anderko from Georgetown University. In previous media modules, we've learned about how mercury enters the food chain, how methylmercury impacts health, ways to evaluate for mercury exposure, and strategies to reduce exposure. We know that reducing and preventing methylmercury exposure is best accomplished through health information or risk messaging specifically adapted for local populations. This final module will address strategies for effective messaging by healthcare providers. Laura, could you define risk communication and its importance?
Well, risk communication is defined as an exchange of information among interested people about the significance of health risks from a toxin such as methylmercury and the control of a risk factor, including ways to reduce health risks. Unfortunately, despite efforts to inform the public of the risks of methylmercury and safe fish eating guidelines, there's considerable evidence that these messages have not reached people who are at the greatest risk for health effects. Since healthcare providers are trusted by the public and seen as excellent sources of health information, they are integral in getting the word out on safe fish consumption.
What methods are currently used to inform the public about health risks?
One important method is through fish advisories, through the national, state, and local levels. Most fish advisories are posted on websites, distributed through fishing license brochures, or posted on advisory signs near waterways. However, the responsibility to provide fish advisory and fish consumption guidance is split between federal and state agencies, which in some instances have resulted in inconsistent and contradictory messages about actual health risks. The U.S. Food and Drug Administration oversees commercial fish in stores and restaurants. State environmental and public health agencies are responsible for sport-caught fish, and the U.S. EPA has advisories for all sport-caught freshwater fish not covered under local advisories. Further confusion on recommended fish consumption guidelines is created when information is presented by the popular media, and oftentimes it's not consistent with state or national advisories. There is an initiative by several states currently to integrate both sport and commercial fish advisories, which will provide more comprehensive information for the public.
Is there a source where healthcare providers can begin to become informed about these state and national fish advisories?
Yes, the federal government, through the EPA's national listing of fish advisories, maintains a database of these local and state fish advisories as well as safe eating guidelines, and it's an excellent place to begin searching for information. This website can be found in the materials posted in the fishfacts.org website.
After reviewing the national listing of fish advisories, what do you recommend as the next step?
It's important to become familiar with the local advisories as well as educational materials that may be available which address the needs of ethnically diverse groups who can be at an increased risk. In some communities, issues such as language barriers, cultural practices, and contradictory risk messages may actually prevent some people from receiving this essential information. For example, Native Americans who fish on home reservations are not required to purchase a fishing license and therefore may not receive advisory messages included in fishing license brochures. Similarly, advisory signs posted near bodies of water would not likely be effective for urban Latinos who primarily buy their seafood from local markets. Therefore, it's important for health providers to become familiar with how their patients typically get their fish, whether it be commercial or sports fish. These local materials can typically be accessed through many state or local health department websites.
Dr. Anderko, could you summarize key information necessary to enable healthcare providers to be effective in communicating risks to their patients?
Sure. There are three key areas that healthcare providers should be knowledgeable in to be effective. First, become aware of your state's fish monitoring and advisory programs, which provide local and regional fish consumption advisories. Second, become familiar with local cultural perceptions, risks, and language barriers, and design your messages accordingly. Finally, become informed regarding both the risks and the benefits of fish consumption, including the current recommendations, particularly for at-risk populations such as minority groups and children. The risks and benefits include the type of fish consumed and average levels of methylmercury found in that fish. A good rule of thumb to remember is that the smaller the fish, the safer the fish. So, for example, anchovies are a much safer option than swordfish. Also, important to consider is the frequency of consumption as well as the portion size that the patient may be eating. Determining and then effectively communicating the risks and benefits of fish consumption with your patients can be daunting, even for the most experienced provider. The fishfacts.org website has been designed to inform and instruct healthcare providers about fish consumption, toxins, and health effects. For more detailed information on methylmercury and other fish contaminants such as PCBs, as well as other ways to reduce health risks, I encourage all healthcare providers to explore these important materials.